Hey everyone, I'm just gonna get everything settled. Thanks for coming. I am not going to put my camera on because I have been sick for days, so I probably even sound a little froggy. But I'm just gonna get everyone settled, get my screen up, and I will be back. So just give me just a minute and we'll get started in about 8 minutes. Let me know if you can hear me. Thank you for coming. I'm getting everyone settled in right now, and we'll get started in just a few minutes. So if you can hear me, just let me know in the chat box, or you can raise your hand. I think everyone has muted themselves. Okay, Dan, you can hear me. Thank you. Oh, and hey, Ruth, how's it going? Okay. So we'll just wait for everyone to get settled in. Thank you so much for coming, and we'll get started in just a few. Hey everyone, it's Dr. Angie here, and I am a little under the weather, and so I'm just gonna keep it to just audio today. Usually I put video on too, but I'm still in my pajamas. I've been like this for this is day 4. Back to school with my kids always brings something really interesting home. I feel like this is the time of year where I know I'm probably gonna get sick. And I'm just getting everyone settled here. My nanny got sick too, and my kids hardly got sick, which I think is really funny that the adults were totally taken down and the kids were just a little runny nose. So today we're going to talk about CBD. It's one of my favorite things to talk about. It's really an exciting component of the hemp plant, of the cannabis plant. And it's been probably the most powerful and kind of multi-purpose herb that I've used in 12 years of using tons of herbs and natural remedies. And so I could talk about it forever. I put together a really short FAQ, things that people ask me most commonly. But what I'm really interested in doing is hearing your questions and how I can help you with your animal. So I think everyone's settled. I'm sure people will kind of wander in, but let's get started. So I think everyone can see my screen. The most important thing to understand is the difference between marijuana and hemp. And unfortunately, the general public and even most veterinarians don't really understand the difference between this. And I am in a really kind of privileged place because marijuana was legalized in Colorado a long time ago. So this has been the topic of conversation for years now, and it's something that people can talk about and that we can educate each other on. So the difference between marijuana and hemp is really small. They're both cannabis plants. So if someone said, I'm feeding my dog cannabis, oh, you know what? Let me hit record really quick. I want to make sure I'm recording this. Oh wait, I am recording it. Okay, good, because people are going to be upset. We promised them the recording if they couldn't come. So if someone said, yeah, I'm feeding my dog or cat cannabis, you wouldn't know if they were using marijuana or hemp. And if you looked at the plants, they look the same. They have that same kind of marijuana leaf look. But the difference is what's inside the plant and then what we use the plant for. So hemp has very little THC, and a lot of CBD, and marijuana has very little CBD and a lot of THC. And THC is the psychoactive component, so that's a part that gets you high. And CBD doesn't have any psychoactive properties, and it's medicinal. Now, THC is also medicinal. We'll talk about that later. But we are definitely not trying to get our pets high. Dogs have a lot more THC receptors in their brains, especially in the part of their brain that controls balance. So even just a little bit of THC, something that would comfortably get a human high, is really kind of catastrophic temporarily for dogs. For the most part, dogs live through marijuana toxicity. Some very small dogs might stop breathing, so sometimes you have to ventilate them. But for the most part, it's just a really crappy day for them, and they get really sick. So when we think about CBD, we're thinking about, or hemp, we're thinking about high levels of CBD. Now, this is really an oversimplification, because in both marijuana and hemp, there are a lot more medicinal parts of the plant that no one's talking about. I'm sure as we discover all of them, like CBN, CBG, the terpenes, there's all types of components that are actually beneficial. And so that's why using the whole plant and not a CBD isolate can be really helpful, because I'm not sure that we can even classify how much of the benefits coming from CBD versus all of the other, what we call phytocannabinoids. So now we understand the difference between hemp and marijuana. I feel like that's just really like the most basic level. Okay, so does my pet need THC with CBD for efficacy? Oh, hold on, I'm blowing through my slides here. No, you will find a lot, if you Google, THC or marijuana or cannabis for pets enough, you'll find a lot of people that claim, like, to fight cancer, you need THC. For it to be effective, you need THC. And it's not true. We can't treat dogs, especially dogs like small humans, because they have a different, like I said earlier, they have different concentrations of these THC receptors in their central nervous system. Now, I think in the future, we will find maybe that THC has some benefits, but until we really study that, and THC is technically still controlled, and I don't think any veterinarian would support that. I see great results with CBD, and CBD has a lot of the same cancer-fighting properties, and we don't have to worry about getting our pets high, because unfortunately, and I don't know how many people in this group have been high, but it can actually feel really bad. So I am a person that THC in any amount makes me super anxious. It makes me feel really uncomfortable. It makes my sinuses feel weird. Like, I have the most kind of random reactions. So, like, I'm not in Boulder getting high all the time, or I don't use marijuana recreationally, because it just makes me feel not good. And that when we're talking about our cats and dogs, like, they can't tell us, like, hey, this is making me feel super anxious and paranoid. I'm hallucinating. This feels really bad. So I don't recommend THC, because I just don't think we need it. Can I use HempRx or CBD with other medications? I get this one a ton, because most of the time when we're using CBD or hemp, there are other diseases going on, and we're probably using some sort of pharmaceuticals. And so the answer is probably yes. Like I've actually never seen an interaction with a drug and CBD or hemp. But what we think in theory could be problematic, which again, I've never appreciated it in clinical practice, are SSRIs, so antidepressants. Both SSRIs like Prozac and Celexa and those types of drugs, they increase serotonin, and actually so does hemp. Hemp also increases serotonin. So there's a thing called serotonin syndrome that could happen. Now, I've never seen it happen, but if you gave them both together, technically it could. So whenever I'm using SSRIs and hemp together, I just go really slowly, and I've never had a problem. And I do use them together frequently because dogs and cats with anxiety benefit greatly from hemp, and they might already be using SSRIs, or we might start out with some hemp. That's not enough. Maybe we try to find a really low dose of Prozac that can help. Anticonvulsants, let me let somebody in. Anticonvulsants are another drug that theoretically could have a problem. Again, in clinical practice, I've never seen it be a problem. I've never had a colleague tell me that they had a problem with it. So far, it's all like a theoretical interaction. And basically, what could happen with some of the anticonvulsants, like anti-seizure medications, like phenobarbital, is that CBD could make the liver change the way it metabolizes these anticonvulsants and could actually increase the blood levels, if that makes sense. So it could make it a little bit more effective. And there are some drugs that we want to get in this like perfect therapeutic range. Now, I've had dogs on phenobarbital and CBD, and I've never seen a change in the levels of anticonvulsants. But when I'm using them together, I just go slowly. And with these anticonvulsants that we worry about, most of the time, you're checking blood levels with your veterinarian anyways. And so it's just kind of theoretical, like this is what you'd find if you Googled. The other one's opioids. And I have to say, I don't use CBD and opioids a ton together. I'd say when we're using long-term opioids in veterinary medicine, we're using them in the context of maybe like hospice or end of life. Technically, they could have some interactions. I don't think anyone has appreciated them. And I think by the time you get to this point, if your dog or cat's in this level of pain, whether or not you're adding on CBD is probably not consequential. So this is another big question, and I'm happy to help everyone here calculate a dose today if I'm happy to be your calculator. Because the calculation, if you don't, like every day I calculate drug dosages, so this feels like really second nature to me. But what's tricky about drug dosages is they come in milligrams per kilogram, and when you look at your bottle of hemp, it's in drops or mils. And so trying to figure out how to get your dog's weight from pounds into how many drops or mils do I give can be a little bit tricky. But the short and dirty, and I have 2 blog articles that walk you through this as well. You want to calculate your dog or cat's body weight in kilograms. So unless you're not in the US, I mean, you probably are using kilograms, but in the US we use pounds. Some veterinary records have it in kilograms, but if you weigh your dog or cat and you divide it by 2.2, that gets your weight from pounds to kilograms. And then you just multiply the number of kilograms by the dose. So I start with a dose of 1/2 of a mg per kg twice a day. And so then I would take that new weight in kilograms and multiply it by 0.5. And then you just get milligrams because those kilograms cancel out. So I was like, probably too much math on Tuesday lunch hour. But I can help you calculate, and I can also walk you through as many calculations as you want, or I can just calculate for you. So I usually start off with 1/2 mg per kg. For dogs and cats with seizure disorders, I've gone up to 3 milligrams per kilogram, which is a giant dose increase. Usually I find I can get pretty good efficacy at 1 mg per kg. which for this is twice as much. And I usually do it twice a day. The biggest problem with these higher dosing is it's expensive. And if you had an 80-pound dog and you were dosing them out at 1 mg per kg, it's gonna be an expensive thing to do every month. So I usually start low and then work up to see if I can find the lowest effective dose. And then, can I use it by itself for pain? I get a lot of inquiries about this, like, maybe someone's cat or dog has a tumor or something really painful. And I would say no. For arthritis pain that's mild, absolutely. For just aches and pains, yes. And I think you could use it as an adjuvant with, like, an adjunct to other pain medications. But if you're talking about like cancer pain, bone cancer pain, I do not think this is sufficient enough. Post-operatively, it's not sufficient enough. Like if your dog was spayed or neutered, you can use it in conjunction with the other medications that your vet recommends. And there are a lot of people that understandably want to avoid a lot of the pharmaceuticals. And I think it's important to remember that actually pain decreases healing. And so controlling your dog or cat's pain post-operatively, even if it's not natural, even if you have to use like Rimadyl or a drug like Medicam, that is still better than not controlling their pain at all. And our cats and dogs are master. They can hide their pain. They're just masters at hiding all of that. And so I think it's important to go ahead and use everything you can, including drugs, especially for the first 24 hours. It's always the worst. And then, why is it so expensive? I get this all the time, and this is a really tricky question. It's expensive because it's hard to grow, and it's really popular, and so it's becoming more in demand as people use it and realize it works. Like I take 50 milligrams of CBD every night before I go to bed. It's a habit that costs me about $175 a month, but it's worth it for me. It really helps level out my anxiety and it helps me with sleep. But it's expensive, and you'll find a lot of products that are labeled for pets that seem really inexpensive. Like a bottle of Hemp RX is $110, and then people say, well, why would I buy that when I could buy this bottle of Pet Relief for $40? And my answer to that is that you will literally just get less milligrams. And so you really do get what you pay for. And a lot of times either the extraction technique is not as good, or you just don't have as many milligrams in the bottle. So maybe you have a similar amount of volume, but it's super dilute. And this becomes really problematic for cats. Especially cats in my practice, because people are always trying to save money, and I completely get it. Hemp is really expensive. But if you do that, then you have to give more volume, and the bottle's not going to last very long to get a good therapeutic dose. The other problem with some of those like pet-specific labeling is that they don't, the dose that they recommend is just not, it's not really high enough to do anything, in my opinion. So when people have tried that with their pets and it's failed, I always ask them to either retake the bottle that they're using and just increase the dose, or I ask them to get a more concentrated product. And then one more thing on this, with the Farm Bill of 2018 that passed in December, and it basically, what it did is it federally legalized hemp. So more states are growing it, and I hope that makes it less expensive. And I think as the supply increases, hopefully, and the demand, the supply can start keeping up with the demand, if you will. Even Hemp RX, sometimes the manufacturer of the actual hemp oil puts their stuff on back order. And so I see that happen. And hopefully that will happen less, because more and more states are really seeing the economic benefit into getting into growing. And then I'll get a lot of people email me saying, hey, is brand X a good choice? Should I, is this okay? And sometimes I have time to look into these brands, and I try to keep up with some of the most popular brands. And the good news is there are a few good brands out there. Like there are a lot of people that are trying to get into the business that are really trying to make good hemp. The bad news is there's some really bad brands out there doing not so great stuff. So what I look for in a brand is that they're first how they're growing their hemp. So HempRx is grown in Colorado Springs and is grown organically. So you want to make sure that that is happening and that they can certify that it's grown organically with a certificate of analysis or something to show that they're testing the batches and that they're not finding any pesticides. You also want to make sure that they're using a clean extraction method. Most of them are. That's usually an easy one to pass. CO2 is my favorite. Ethanol is really not the worst. It might be, in some way superior. There's a lot of, I'd say, debate in the industry about the best way to extract cannabis. And then you want to make sure that what they're using, they say, is in the bottle. So we had a brand, and I can't remember what it was, but one of my clients was using it, and it said in each 1 mil, there's like 38.2 milligrams of CBD or hemp extract. But then when we actually called them, there was like 3 milligrams of CBD in there. And it's tricky because we can't actually put there's 10 milligrams of CBD because the FDA won't allow it. And so most companies put a CBD extract or a hemp extract amount. But this is something that you want to, if you're not using HempRx, because I can always tell you how many milligrams are in HempRx, you want to call the company and make sure that you know exactly how many milligrams of CBD are in each chew or drop or mill, however you're getting it. So that's really important to know your brand, know the ingredients. I like HempRx because they use hemp oil. And so I have a ton of sensitive patients in my practice, and I'm just giving them one ingredient. Because if someone has a reaction, it's like, is it a reaction to coconut oil or some other carrier oil? So I like that it's just really simple. If there was a reaction, it's either to hemp, the hemp plant in general, and we either try a CBD isolate, or we just say this is not for us. So those are all the slides I have, but I will talk about anything CBD related. I want to make sure that I answer all your questions. So you can either put them in the chat box, or you can raise your hand and I can unmute you. Let me know if you have any questions. I'll just give it a few minutes. See if anyone has any questions. One thing
Angie, this is Ruth. Can you hear me?
Hey, Ruth, I can hear you.
Oh, good. I couldn't figure out how to raise my hand, so I unmuted.
Perfect.
So we have a very anxious dog. It's not just anxious during thunderstorms. She's anxious when somebody comes to the door, when the cats are doing weird things to each other. So my question is, do I need to do this doser every day? And is that important to keep that level up?
I would do it every day. It sounds like so much of life stresses your dog out. So I think I would do it twice a day.
Okay.
Every day, and see how that helps.
Okay. So I was a little confused by the math, not my strong point. So she's 50 pounds.
Okay.
So, yeah, maybe we can run through that, and that'll help others too.
Yes. Okay. So she's 50 pounds. I'm going to divide that by 2.2. So she's 22.7 kilograms.
Right.
And I would start out with a 0.5 mg per kg. So I'm going to take that 22.7 times 1/2. And so that's about 11 milligrams twice a day. Now, for anxious dogs, every once in a while, I'll just start out with half that dose, only because I feel like it's going to work pretty well, and I want to figure out what my smallest dose, because once it works, you're never going to want to stop. And so then we have to think, how are we going to afford our hemp habits? So, so I might start off with 5 milligrams twice a day. And then, do you already have a product you're using?
I do.
Okay. And does it tell you exactly how much Like, could you figure out by looking at the bottle how much to give to get 5 milligrams?
I'll grab it when someone else is talking. I
Okay.
don't have it in front of me. Yeah.
Okay. Yeah. And then what I like about using CBD for anxiety is that usually you notice right away. It's nothing that you have to wait weeks to notice.
Right.
You're going to notice in the first couple of days whether it's helping, and then you can quickly move up to 10. And you could go way past 10. You could go to 20, you could go
Okay.
to 25. And those are the doses where it starts to be a little bit expensive. I mean,
Yeah, no doubt. Yeah. We've given her trazodone in the past, and it just knocks her out. Will CBD oil ever do that?
I have had CBD oil be a little bit sedating, especially I've only seen it happen in senior labs, like
Okay.
dogs that were just really kind of chill to begin with.
Okay.
But anxious dogs, I've never seen it knock them out. But
Okay, good.
if she's sensitive to drugs, I think that would be another good reason to start with that 5 milligrams twice a day.
Right.
And
Okay.
then slowly.
Thank you.
Yeah, no problem. Okay, I have a question in the chat. I have a 2.5-year-old cat. He's a little bit, he's naughty. We now have a second cat who is a sweetheart. We are working on introducing them, but I want to know if CBD would help them get comfortable together. The naughty kitty's already on trazodone. I would try CBD. It's really effective for anxiety, especially in these types of situations. So I think it's worth it. And then someone commented that THC builds up in tissue, wondering if CBD does too. I think CBD does. Now, we don't have any pharmacokinetic studies to confirm that. But over time, I've noticed like certain conditions like arthritis, I feel like it takes a little bit longer to see that maximal effect. Although with anxiety, I see it right away. But it can be helpful to give it long-term over time. And then another question, how do you get a cat to take the CBD? My cat Max started eating the CBD treats, but now won't touch them. Hey, Marguerite. That is tricky. Cats are tricky. My cats will not touch the CBD chews. Most cats will. We have a really good success rate. We rarely get returns on those. But I would say try the oil. Marguerite, have you tried the oil?
Yeah, I bought the oil. I think the mistake I made was I should have just started putting a few drops in his food. Instead, I try to put a few drops right on his gums.
Oh, yeah.
And it tastes and smells so nasty. So then after I tried burying just a few drops in his wet food, he took one whiff and refused to eat it.
Right. What about does he like freeze-dried treats at all?
I have never tried that.
Does he like fish? Is he a fish cat?
Yeah.
Okay, so there are all kinds of like producers of these like stinky freeze-dried fish treats, like so smelly. I would try putting a drop on there and see if that works. Because it's like you have to overcome that smell.
And then are the freeze-dried treats, are they just, what form are they in? You do heat them up or do you just?
Yeah, they just like come out. They look like astronaut food. And they
Okay.
come out in these little tiny cubes.
Now, do you know if they're really high in salt? Because he's having some issues with, he's not drinking enough water. He's got a little problem with his bowel movements recently, I think, because now that his thyroid's under control, he's not drinking enough water.
Oh, yeah. He's
probably got
some kidney disease underneath it, huh?
Yeah. So I know sometimes with freeze-dried, it can have a lot of sodium.
It can. I wonder too, but the oil might be helpful too. Just adding a little more fat.
Yeah.
I don't know if it would be enough to matter.
Okay.
Yeah.
And then can you just buy those treats anywhere? Or do they have them at pet stores?
Yeah.
Or?
Where do you live?
I live in LA.
Then you'll definitely, like a natural pet food boutique. They'll have a ton of them. Yeah.
Okay.
Just ask them for something really stinky. I feel like the fish is just the stinkiest.
Okay.
I have something else.
And then just put a drop or two of the oil right on it and see if it. Okay, it's worth trying because otherwise the only other thing I've had to do is I bought some small little clear gelatin.
Mm-hmm.
But then I have to pill him, I have to put the oil in the capsule and pill him. And of course, he doesn't like that. So
Right.
I'm willing to try anything. So maybe, yeah, if he likes those stinky treats, I can mask it somehow.
Yes. Yeah. Let me know if that works. That has previously worked for a lot of our patients.
Okay, great. Thank you.
Yeah, no problem. Okay. So Meredith writes, I rescued a 6-month-old female kitten with something wrong with her lower back. She has trouble standing and can't hold her bladder. CT scan was clear. She responded to steroids as far as standing better and using her back legs, but I don't want to keep her on steroids. She's happy and healthy, and I even have a hard time keeping up with her when she scoots. She's fast. Yes, or are you wondering if, you want to try CBD? I think trying CBD would be totally fine, and you can use CBD with steroids too. So that would be no problem at all. And then I have another question. How do you adjust dose if it builds up then? Confused. So if it builds up, so what we do know, like the half-life of CBD in dogs, so we just have like a few small pharmacokinetic studies, is just like a few hours. And so that's why we dose every 12 hours. So it's not that it's going to it doesn't literally stay in tissue. It's not like it's getting stored in the tissue, but it might be that over time we do have a little bit more of a cumulative effect. We don't know that for sure, but I do increase dose just based off of how my patient's doing. So let me know if that answers your question or not. And then Joy writes, why do you feel the CBD helps with IBD? Also, how do you think it impacts ulcers, as my guy has multiple from the esophagus, stomach, and intestines? I think CBD can help with IBD. I've never had it in dogs or cats that have really severe CBD. I've never had it be the only thing. It's never been like the rescue agent in my experience. And I'm not saying it couldn't happen, but when dogs and cats just get so bad that we can't keep weight on them and they're vomiting all the time, like absolutely miserable, CBD's never been the magic thing that made it stop. Usually at that point, we're doing steroids or some type of drugs. I don't know how CBD would impact ulcers. It depends on why the ulcers are there. I don't think it would hurt them and it wouldn't make them worse. But I haven't ever used them to heal up ulcers by itself. And then Meredith writes again, I'd like to try CBD, but I don't know what, if at all, it could benefit her since we don't know what is causing her not to be able to use her back legs. Yeah, I think that's tricky. I don't know, since we don't know what's wrong, I think it would just be one of those things like where you would just try, because steroids seem to be helping. So when you're using an anti-inflammatory, which steroids are just a stronger anti-inflammatory compared with CBD, the hope is that, all of the endocannabinoid receptors in the central nervous system along the spinal cord, that maybe we could somehow affect a change, but we don't really know what we're treating. And so that's tricky, but I don't think there'd be any downside to trying it. And then Dan writes, for dosing, you're saying kgs per mg or like mgs per kg. How do you determine how many mils in order to give in a syringe? That is an excellent question. So once we've figured out how many milligrams that you want to give, then you have to go to the product you're using. And Dan, are you using HempRx? Because you're here.
Can you hear me?
Yeah, I can hear you.
Okay, yeah, I'm not using it yet, but that's what I would like to try, would be the HempRx.
Okay, and then you have a cat or a dog?
I have a cat. I have 2 cats, actually, that I want to try this with.
And then how much-ish do your cats weigh?
I have one of them weighs approximately 10 pounds. The other weighs approximately 20 pounds.
Oh, okay, so we can just figure out the 10-pound.
The big girl.
Okay. Okay, and then what are you using it for?
Well, the smaller one, she is constantly grooming herself, and then she also has this head twitch thing she does, and then when she's resting, she'll twitch her paws her front paws, and like something's getting at her. I took her to the vet, and he didn't think it was, hyperesthesia or anything like that, but they don't know what it is. So mostly, if I could just slow her down, she's very anxious. She's a very anxious animal, and to take her to the vet, I would rather smash my finger with a hammer.
Seriously.
I would pay you to get on a plane and come and see my cat before I could take her. But the other one, she has been diagnosed with, as they called it, severe arthritis in her elbows.
Okay.
And she's currently on gabapentin, but it's I think it's a well, she's way low on the dosage. It's basically like 20, I think it's like 20 milligrams, a day that she's getting, and she should be getting a lot more than that. But I don't want to put her on that because I want to see what this is going to do.
Yes. And is she the 20-pound cat or is she the 10-pound cat?
She's the 20-pounder.
Okay. So that's tricky. And this happens a lot where I'm assuming that she's overweight and she's not just like a Maine Coon or anything.
No, she's a Maine Coon.
Oh, she's a Maine Coon. Okay.
Yeah, she's just a big girl.
Okay, no, she's legitimately, okay. Because the other thing is like, the elbow arthritis is tricky because you want to keep them as lean as possible. So I don't know, since I can't see her, I don't know how much weight she could actually lose. But Maine Coons are just huge. And so that would be another thing. But yeah, CBD could be really helpful. So let me calculate a dose. So for your 10-pound kitty.
Now I'm looking at your, I forget what it was actually titled, but basically it's the chart, the cannabis pet dosing chart. And in there, it does state the milliliters in there, but what was confusing is it had like a column that said CBD, then one that said hemp RX, and then hemp RX Forte.
Yeah.
And so I'm like, okay, is the CBD something different than the hemp RX, or I think you cleared that up.
We have since split that chart out because basically what I did is I wanted to, like, if you're not using hemp RX, here's how much CBD you need. So like if you're using a different product,
okay,
how many milligrams of CBD.
Okay.
But what I would do, and are your kitties picky?
In terms of eating?
Yeah, like because, for your 20-pound cat, the amount of volume with just the hemp RX is going to be a lot, but the hemp RX Forte is going to be a lot easier because you're going to need a lot less. So that's what I would recommend starting with. It'll last you a really long time, so you just want to make sure it's going to stay in the fridge. But for your 10-pound kitty, with the hemp RX Forte, I would start with 2 to 3 drops twice a day. And then with your 20-pound kitty, I would start with like 4 to 5 drops twice a day, and then you can work up. But if you use the hemp RX and you're using, instead of 4 to 5, you're using 8 to 10, I feel like that gets to this place in volume where cats are just like, I'm not going to do that. It's a lot of volume.
Yeah. Now, I would prefer, because number one, the big girl, she's really good at taking her gabapentin via syringe.
Okay.
And so I would prefer to do it that way. The other one, she doesn't prefer to do anything. I've tried everything. I wish this stuff was transdermal somehow, but in any event, what I'm trying to do, and being that it seems like it's quite low in the dosage of 0.1 to, and it says 0.1 here to 0.1 mil. First of all, I had to find a syringe that was, that would get me down, because I want to start like at half that just to see how she's going to react, and so on and so forth. And right before I got on this thing here, I did finally find a place that had syringes that were 0.5 milliliters, so that graduated it really nice for me. So I figure if I can shoot it in her mouth and she'll swallow it, then I can do that. But I don't think if I put it on her food, what I don't want is for her to not want to eat her food.
Right.
I spend a lot of money on food. She eats holistic food, and it's very expensive. And if she stops eating her canned food and or her dry food, that could be not so good. Now, the only other thing I thought of is that she likes these little hypoallergenic treats that I give, and I thought, well, maybe I could put a little hole in it kind of thing, and then put a drop in, and then see if she'll just gobble it up. And so I'm just kind of, I mean, a lot of this, and maybe other people out there are probably the same way, is when I started following you for some time, and it's just, I think there's a big fear. And, when you read that there's not a lot of research and so on and so forth, but I'm at the point where I got to try to do something for both of them other than just keep medicating the one even higher and higher. And I don't want to do that. So if this will work,
Right. Yeah, I think this has the potential to be extremely helpful. And
Okay.
so one thing you could do is just get the regular hemp RX, because if you're feeling like for your kitty, that your 20-pound kitty, if you wanted to use a syringe, and if you order hemp RX from us, just put in the notes that we'll send you with some syringes too.
We have plenty. We have.
Okay, you're
I have
stocked up on
tons of syringes because, like I say, every day she gets her gabapentin, and it's it's a little, I don't know, 0.5 milliliters or something like that. And she takes it really, really well. So
Okay.
I don't think that's going to be a problem. I think I like your idea of the Forte because of the amount and so on and so forth. But I guess my first thought was just to try this.
Yeah.
I'm willing to spend the money.
Yeah.
If it's certainly if it has potential to do at least the calming effect. I think that's what my one little girl needs more than anything.
Yes.
She needs to be calmed down, and she's like, I don't know. I just want to help her out. That's all.
No, I think that's great. Yeah, try the hemp RX, and then if it works out and it's something you want to do long term, I would do the Forte. Will just save you so much more money.
Yeah.
Each bottle will just last you for quite a while, which is fine. Just keep it in the refrigerator, and but let me know how it works. I'll be really interested to know.
Yes, I will. I certainly will.
All right. Let's see. I have a couple other questions in the feed. Let's see. Just want to make sure I get everyone's. I was giving CBD to my cat for asthma and she got diarrhea, so I stopped and the diarrhea stopped. I was wondering if you have had CBD cause diarrhea with any of your plants. Yes, I have. I started slow and increased to your recommended dose for asthma. I can't think of the brand right now that had the minimum of THC, like 0.5. So for hemp to be classified as hemp, it has to have less than 0.3% THC. It was for pets though. Could it be the oil? Could it be a drug reaction? It was helping and the diarrhea didn't happen right away. Well, that's super frustrating. So I think I would try a different formulation. I wonder if you had to give a ton of oil, and I wonder if trying something really concentrated like the Hemp RX Forte, where you had to do less, but you got the same milligrams of CBD. The other thing, if we find that like your cat just gets diarrhea with hemp, is that you could always try an isolate. And basically that's where they just take CBD out. It's a lot less expensive. It usually comes in like a white powder, but that's something to consider. I don't usually recommend it because I'm not sure it's as effective, but in these situations, like we don't want your cat having diarrhea. We don't want to trade like better breathing for lots of diarrhea. And so, yeah, that's what I would try. It could definitely be the oil. The other thing you could try is like putting it in a treat form, like the soft chews, and see if that helps. But I think some cats and dogs are just sensitive to the hemp plant. It's extremely rare, but just like anything, it's possible to be allergic. And then there's a question, what's the difference between HempRx and the Forte version? So the Forte version is just more concentrated and it's a much bigger volume. So it's easier to give and it's much more cost effective over time. Like I have all my animals and one of my kids on CBD. So I just open up a Forte in my house because it'll just last me a lot longer. And so I like that. If you're starting out and you have a cat, probably the HempRx is totally fine. Unless your cat is big or picky about volume, then the Forte is going to be easier. But, from 20 pounds up, like that, the Forte is just such a better deal and it's going to last a lot longer. It's just the sticker price is tough at like 200 and I don't know, it's 220 or $210. I can't remember how much it is, but it's, it's a lot. It's just over time, it's going to save you a ton of money. Okay. And then so just a follow-up question about the kitty we were using CBD with that got diarrhea. I used a bottle with 150 milligrams of CBD. Yeah, so I can tell you automatically that bottle was very, very dilute. So if you tried something like the Forte, I would think that maybe you could just use a couple of drops and get the same results and then maybe not get the diarrhea. And then can you talk more about treating asthma? Yes, I have definitely seen a lot of successful cases where asthma helped decrease the need for inhalers and steroids. And so I've used it successfully with kitties with asthma. I also use herbs for asthma too. So if you can find a veterinary herbalist by you, I've also kept cats off of steroids that way too. Does anybody else have questions?
Angie, Dan again.
Yeah.
I received something today, I think it was today, emailed about I want to say it's a course or I forget what it was exactly, and I don't want to lose you on the screen here, so I don't want to go and look. But what is it about that we wouldn't be able to find? Here that we wouldn't have seen.
Oh, is it the Miracle Herb course?
Yeah, that's it. Yeah.
Yeah. So that is a course that we put together for people that are wanting to use CBD for their animals, for their cats or dogs, and just want to learn as much as possible about it. So in that course, I go into the endocannabinoid system and I talk about calculating a dose. There's even you get a dose calculator in the back end, so you can just plug in the weight of your pet, although we just calculated a dose for you here today. And so you get those types of things, and I break it down more for each disease process. So I don't know that you would need that now. It sounds like kind of what product you want to get started with. You have a good dose and if you feel confident using it. But it just provides a lot more information about picking products. So each thing goes into each of the modules goes into a little bit more detail than what we're doing here today.
I was giving a plug for it there.
Oh, thank you. Thank you. Yeah, no, it's really great because there's so much to talk about. So yeah, so if anyone's interested, I can get you a link to sign up for that. Okay, one more question's coming. Can you talk about digestive issues in general and if CBD can help? I took the course and really liked it. Oh, thank you. I'm glad you liked it. I spent a long time trying to distill all the information I had into something that would be useful because there's actually, even though veterinarians want to say, well, we don't have a lot of information, we actually have a ton of information. So digestive issues in CBD, this has been a really tricky spot for me because I haven't seen anything really consistent. Like with anxiety, I feel really confident that when I prescribe HempRx for my patient's anxiety, that we're going to notice a difference. It might not be the whole difference, but I'm going to see improvement. Or when, geriatric cats with arthritis, I feel really good that I'm going to improve their life. digestive issues, I don't know. I've had some animals that like CBD changed the game for them, and other animals where we added CBD on and we're like, I don't know, did that help? And then everyone's looking around saying like, I'm not sure. And so I feel like it's really hit or miss. And my guess is because digestive issues are maybe more complicated on some level, and so treating them is so much more complicated because then we have food allergies and all the gut bacteria and the balance of that, all in combination with like a million other factors. So that's the long and the short of it. I feel like I can't say with any certainty that I've definitely, like my cat patients with IBD, it can certainly be helpful. And I use it. And I think if nothing else, it does help. I think that's worth a lot, especially when they're dealing with chronic disease.
Hello, can I ask? I just thought it'd be easier to just unmute myself.
Yes.
I heard if you give CBD oil, it can remind the body that maybe the body's forgotten how to produce their own cannabinoids. Mm-hmm. And so my question would be, over time, maybe after giving it for a while, maybe the animal doesn't need it any longer.
Yes. It's interesting that I've had this discussion with other veterinarians that, because the endocannabinoid system in our body is responsible for so many things, and we think about it just generally responsible for homeostasis, like homeostasis of the immune system, homeostasis of inflammation. So basically like kind of hitting that really nice balance point. And so I actually do think that there's a possibility, and I think especially when it comes to anxiety, that we could use it for a time and like remind the body that this is, this is center, and that could be really helpful. But we don't have any studies, and I don't know that we'll have studies to prove that for a long time. And it's tricky in my own practice. When something works, it's really hard for people to want to stop. And so if you find that it's helping and you do stop and it keeps helping, I would love to know that. That is information that I think that could be really helpful. But how the mechanism of action would make me think that that is 100% possible.
I have another one. I know you're giving it to your cats, and I've read anyway your newsletters, and I think it's kind of a high dose. What's been your experience with that, giving it to them?
My cats, like as far as them actually taking it, or their how it affects them?
Yeah, how it affects them. I give it by dropper, and I've done it to 2 of my cats, and they both seem to enjoy it. Like they don't mind it at all. I use a plastic dropper and just kind of put it in their mouth. Mm-hmm. But anyway, I'd like to know their reactions.
Yeah, so both of my cats eat it in their food. I have one cat that, he weighs all of 5 pounds. He's 20 years old, in-stage kidney failure, and I cannot get a pill down this cat. He's impossible to pill. He is the nicest cat too, but I just can never, even my veterinary nurse, it takes 3 people to pill him. So I'm so grateful that he will eat the hemp RX on his food, but I also do believe that my cats think that they're starving all the time. And so it makes me wonder if they would eat anything on their food. Because they're on an all wet diet, and I think they would eat a million more times a day. And I think that the hemp RX has been a really big appetite stimulant for both of them, especially for my old guy, which has been great because then I can try to keep weight on him. One of my cats has IBD, and I haven't been able to decrease the steroids with him. That's what I was really hoping for at 4 to 5 milligrams twice a day, that I was going to be able to cut his steroids at least in half. I have not noticed that be the case. With him, what I have noticed is that he is very sensitive to what he eats. And he tends to get on counters and eat whatever he can find. And so that's when I find that he has a lot of symptoms. And then my old cat with arthritis and kidney disease, I think it really helps stimulate his appetite, which is good because he will waste away to nothing if he doesn't keep eating. And then for some reason, my sharing just stopped. Let me bring this back up. But I do think, can everyone see my screen again?
Yes,
yeah.
I can.
I do think it's helped him get around. He has a ton of arthritis. And so I think generally it's been helpful for him. And I think that both of the cats are intermittently stressed out by my pug and my toddler. And so I use it for that as well.
So what's the highest dose that you give? It's 45 milligrams a day.
4 to 5 twice a day. Like, so my 5-pound cat, I'll give him 4 to 5 milligrams twice a day. Let me figure out what that is. It's a pretty high dose. He does actually quite well with it.
Great. Well, thank you.
You're welcome. I'm kind of curious. I don't know why my screen keeps going off like this. Does it, right now, do you guys see my screen, or does it go away for you too?
I see your screen.
Oh, okay, it's just going away for me. Then I won't worry about it. Okay, a few more questions. Does CBD help with skin issues? Yes, I have seen itchy dogs get a lot better with CBD, but not regularly. I can't count on that. My dog has really itchy skin. He's got food allergies and environmental allergies, and it does not help him. But I've had other patients where it was just really successful. What about OCD issues? Yes, I think any of the, if the OCD is really bad, probably some SSRIs just to help smooth out life is good, but I would try CBD first. And CBD does increase appetite. I have not noticed this in dogs, which is, I don't know if because most dogs want to eat all the time anyways, but I definitely see it in cats, which is usually to our advantage. It's usually to our advantage. So, but sometimes like with my cat with IBD, it's tricky because I want him to keep eating, but I don't want him to be so hungry that he's jumping up on the counter when I leave the room and eating something that's going to upset his stomach and cause vomiting and diarrhea. So that's kind of tricky. Do we have any other questions? Oh, I think that's it. Okay. Well, thank you for coming and spending your lunch hour or whatever hour it is for you with me.
I'm sorry, one real quick. Have you heard of the brand Flower Child? Do you know if that's
no, but we can look at it right now.
Okay, because they are in Colorado also.
Okay. Let's see. I wonder if I can. Okay, it's Flower Child. Is that what you're using?
Yes, and they had an oil specifically for small animals. I think it's 350 is the strength or whatever it's called for pets. 350.
Okay.
CBD.
Okay, so it's a tincture. Oh, pet products. Okay. I appreciate that all these brands are thinking about pets. I'm so happy that everyone's thinking about pets. Sometimes I'm just like, oh, don't get the pet oil, just get what? Okay, so you're getting the 350.
Yes.
Then I wonder, like, how much extra are we paying for packaging and stuff? Let's see, whole plant extract, food grade alcohol. Okay, so they extract using ethanol, which, I mean, there are some extraction guys that would tell you that we don't know if that's great.
Okay.
I wouldn't rule it out. Like, I would take stuff extracted with ethanol, but cooked off. Let's see, all the terpenes, flavonoids, and healing compounds are retained. Oh, and then so added to grapeseed oil. Okay, so let's see if we can find any more information. Okay, so there's 12 milligrams per dropper. I appreciate that. I hope they mean 12 milligrams of CBD. that's tricky. They can't say that. So it's like, I don't fault them for not saying that, because the FDA would come down on them. And so a half dropper. So they're saying 6 milligrams. And so, like, their dosing schedule, like, I would do something more specific. Like, that's such a,
Yeah, 1 to 3 times. I mean, yeah, I guess you start with half a dropper, maybe once a day. Yeah, it's a 12 milligram dropper is a long dropper. That's the problem, is like half a dropper full is a lot. And that's why, I mean, you can't just dump it in their food or in their mouth, because it's just, it's really strong.
I know. And this is where I feel like they're not doing any of us any favors, because if they could just make it more concentrated, then you wouldn't have to do that.
And give them less. Yeah.
Yes. Yeah. That's what's tricky. And are you giving it to a cat or a dog?
A cat.
Yeah, I know. Yes. And it's probably, let's see, how much is this? Right. Like, it's more affordable price point to get in. It's just,
it is. Yeah.
Yeah. But then actually executing it and then getting, okay. So is your kitty around 10 pounds?
He is about 13 pounds.
Okay. So I would start off with 3 milligrams. So I would start off with 1/4 of a dropper. Twice.
Yeah, at this point, I was the person who asked about the freeze-dried stuff. If I can't get him to take it a few drops on the freeze-dried, I'm kind of screwed, because I do not want to have to pour it into a capsule and try to get it down him twice a day. That's just, I mean, I'm already giving him the other meds, and at least those for now I can put them in a pill pocket, but.
Yes. And then, and have you tried the HempRx, the soft chews?
Yeah, that's what I started with. I bought the HempRx soft chews, and he ate those for a week and a half, and then now he will not. I've dunked them in chicken broth. He won't eat them. He just, again, I would have to like force them down his throat. It's like, nope, don't want those anymore.
Right. I'm just seeing if they have, like, for their human product, like, the only thing is we don't want to give our cat peppermint oil.
Ew, no.
Yeah. So that doesn't help us. And I think they might have a stronger pet one too. CBD. Okay, the 700. Yeah. And let's see, 24 milli. Yeah. So basically, it's a similar type of, this is twice as concentrated.
Right.
Yeah. The other thing that's tricky, I wish these companies would do, that HempRx or the RX vitamins did, is they calculated what each drop had. Because especially when it comes to kids, that can be helpful.
Yeah.
Marguerite, what about the syringe in him? I mean, if it's only on this chart here, it looks like 0.1 milliliter. I mean, that's pretty low.
Well, I didn't have I tried just taking the dropper and placing a few drops like on his gums. Mm-hmm. The problem is it's such a strong taste. And with an oil, it's you can't really squirt it down the way you can if it's like a liquid, more like a water, I might try. If it just wasn't such a harsh flavor.
What if your vet could maybe, like my vet, I always get all medications in like the tuna flavored, I don't know what it is, water or whatever it is, but maybe you could, pull in some of that, and then it would, I don't know if it would go down easier.
I'm sorry, get some what from the vet?
It's like a tuna flavored liquid.
Oh.
Every time if I have like gabapentin or any pills or whatever that I can, I ask them to put it in liquid form and use the tuna flavored liquid.
So you just add it to that tuna flavored liquid to.
Yeah, just sucks, as you pull, get your amount of your CBD and then just pull some of that up and see if that might help it go down. He'd swallow it pretty quick then maybe.
That's true.
Might. I don't know.
It might work.
I've tried everything, so
yeah, I'm like, it's like why can't they just be like a dog? You just you coat it in peanut butter and they're gonna eat it.
Right. Yeah.
I feel like we should have a whole forum where we can swap ideas on how to medicate our cats.
You know what?
Great
I
idea.
would love to hear that one. I mean, how to get medication in an animal. I'm telling you, every time I ask my vet and he says, well, what about this medicine? I say, is it transdermal?
I know.
Please, can it be?
Yeah, if they could come up with a transdermal way for CBD, that would be awesome.
Tell me about it.
I know. I bet those studies are happening.
I hope so.
Yeah, because it would be great. It's oil soluble. It's lipophilic, so if anything's going to make it across the dermis, it's going to be CBD. So that would be fantastic. So
that would be a wonderful patent, Angie.
Yes, I know. I'll add that to the list. Okay, well, it was great to hang out with you all. And then I'll put on the list of time where we can all get together and swap medicating techniques. I'll get all the nurses in the practice, and maybe we should just all huddle and decide how, we could do this. Because that's a really great idea, Dan, so in compounding pharmacies, they do use these carriers. And I wonder if adding CBD to those carriers that are chicken or tuna flavor, if that would be a good way to get it down throats. So thank you for that one.
Well, thank you, everybody. I gotta head out, but this was a great chat. So
Thank you.
Thank you,
Okay.
Angie.
Thank you. I'll talk to you all soon.
Okay.
Okay. Bye.
Blessings.